Last night, the welcome news that our country is ready to move to level 1 of our lockdown. The easing of restrictions made possible because COVID infections, hospitalisations and deaths are on the decline. And while we are hopefully through the worst, every move to open up our economy has to be with extreme caution to avoid a second wave. Well, let's talk to the head of the Ministerial Advisory Committee on COVID-19, Professor Salim Abdool Karim. Good evening, Professor. Thanks as always for your time. Let's talk first international travel, starting from the 1st of October. We've now got to work out the countries that we can allow in and then see which countries we're allowed to go to. Could you comment on how the process is likely to work? And just as perhaps a bit of background, when I spoke to our London correspondent a little earlier, he says the way the UK does it is on a rolling 5-day average, I think he said. It has to be, a country has to have 20 cases per 100,000 or less, and he said South Africa is under that amount. Is he correct, and could that mean that we could go and visit the UK sometime soon? And would we apply the same standards for countries coming to us?
Yes, a very good evening to you, Sally, and all of the viewers. Yeah, we've been looking at various countries and how they have been applying their rules. You are correct. We are below that benchmark of 20 per 100,000 per day on a 5-day average. We, for South Africa, have not yet determined what exactly that cutoff will be. It is quite likely to involve two measures, one relating to the number of cases per day on a 7-day or 5-day moving average. We generally in South Africa work with 7-day averages, and the proportion of tests that are positive, because that's a better indicator in terms of ensuring that you are doing enough tests. So I think if we look at that kind of combination, it's not going to be too difficult to work out, which countries will not be on the list of countries we can go to. And probably at this stage, it's probably going to be in the region of around, my guess is, somewhere between 10 and 20 countries. But most of the other countries are at a level that we would comfortably not have a problem with going to, and they were unlikely to have difficulty with us coming to them.
Do you think that list is going to be out well before the 1st of October? Is it something that your team is looking at right now?
So it is not something that the Ministerial Advisory Committee is looking at. It is being handled within the Department of Health. I don't know when that list will come out, but I would expect it to come out pretty soon because airlines need to plan well in advance.
Absolutely. The other thing that's changed is testing protocol, and we're all about trying to prevent the second wave, and this is really good news because now you can test if you've had contact with someone who has COVID but no symptoms. Before, because we had a shortage of tests, you could only really test if you were quite sick. So this surely will help us prevent any possible second wave?
You've got it exactly, Sally. So, when we were short of tests, that became a real challenge for us, and so we had to prioritize our testing. Now we have an abundance of tests, and so that's no longer a constraint. That doesn't mean to say we should just willy-nilly do testing. And so the committee did review the situation and produced a set of priorities, reprioritized them, and that was submitted to the Department of Health. And you saw in the President's announcement, is now the overall strategy we are going with now has a much more open-ended approach to testing, including all inpatients. So we'll get a better idea as an early warning system for whether a second surge is emerging. And we've got a few different strategies to do that, but one of that is patients coming into a health service with symptoms being tested and giving us some clues as to whether numbers are going up or down.
I want to focus now on schools and also on children. The President didn't mention schools at all. We know that the schools do things slightly differently. But they, a lot of the schools are platooning. So they've divided the school in half and you go on an alternate day. Does level 1 mean that we're going to stop that and that all the kids are going to go back 5 days a week? Do you think we should?
No, unfortunately not. So, I've been trying to grapple with, how do we manage the new normal? And so the new normal comprises three key components. The first is that we've got to continue with our prevention strategies, and the three key ones being social distancing, masks, and hand hygiene. So if we are to compromise on our social distancing and our masks in a school situation, we may end up seeing small outbreaks occur. And right now, we've actually got a very contained situation. We've not seen any major outbreaks in our schools. And so that's a very good sign. And now that the case numbers are quite low, we should expect that that will continue. So we will not compromise in terms of our prevention strategies. The other two components of the new normal are firstly the prevention of super spreading events, mainly through mass gatherings, and we have to ensure we have restrictions on those. And then the third is international travel, so that we don't reseed the epidemic within our local context. So those three components are the key pieces in the overall new normal.
Also this week we've heard that multisystem inflammatory syndrome in children is now a notifiable condition in South Africa. We also know that it looks like there's a link between that and COVID. We know this is rare, but there is clear concern for parents. How freaked out should we be?
So, MIS is not a very common condition. I have to say, if you see a condition like that, it's actually quite a rare situation, even in South Africa. The problem was we weren't sure if we were not seeing it because we were not keeping an eye out for it. And the one challenge is that often children with MIS are not positive on a coronavirus PCR test. So you have to actually do an antibody test because this occurs quite far, several days after acute infection. So it is a more complicated condition to diagnose in relation to COVID. And so this notification is a key step to enable us to get a better understanding of how common this is and whether it's increasing or not.
So how many cases have you seen with children who've had COVID who've gone on to get this?
So our colleagues in the pediatric field have been seeing only occasional cases. So I haven't yet got a sense of, has it really gone up or not? Because we don't really have that data yet. And this is part of the solution to getting that data.
Okay, well, we'll definitely keep an eye on that one. But as you stress, it is extremely rare. Thank you very much. Head of the Ministerial Advisory Committee on COVID-19, Professor Salim Abdool Karim.